Okay, so I decided to show the care and maintenance of the microscope in the lab because we use this a lot, especially in a practice that's so busy. We really need to make sure we're taking care of our microscope because hopefully this should last for the lifetime of the practice. Here, I've made sure that it's plugged in. My light is on, it's turned all the way down, and you don't want to be flipping the light on or off too often, and it'll cause it to short and to blow out sooner. So, other parts of the microscope that we need to keep in mind. The eyepieces here have lenses, and so do all of our view pieces on our little turret here. There's also a lens right here that lets the light through the condenser, and then a light source down here. If I were to see any oil or anything, I would want to make sure I use a special wipe. These are nice microscope type slides that are meant for precision cleaning without leaving any scratches, because these lenses are easy to upkeep, but if you scratch them, they're expensive to replace. And if anything more sticky were to get on the cleaners, we could use the manufacturer optical lens cleaner. We always go to the lowest power first because it has the shortest base and it's less likely to swing through and accidentally scrape the bottom of the lens right here. Turn to the 40 times magnification. We call this the high dry because it's a higher magnification, but you don't use any oil. If I were to turn to the highest objective lens, which is 100 times magnification, I would want to make sure that I place a single drop of oil on my slide. That would allow this lens that gets very, very close to the surface of the slide to still view everything while maintaining a distance from the surface of the slide to make sure that it doesn't get scratched. If I were viewing something under the high oil lens and I wanted to go down to a smaller objective lens, I don't want to turn it back to the 40 times power because then I could get oil on my high dry lens. If I were to accidentally swipe my 40 times magnification to the side and get oil on that, I would definitely want to clean that off right away. If I'm done with the 100 times magnification, I'm going to turn the turret back around to the area that has no objective lens so that there's nothing that could actually go underneath and scrape it. If any of my lenses or my condenser pieces or my eyepiece were to get scratched, we do have maintenance personnel that come by and check our microscope for us annually here. Once I'm done with my microscope, I want to make sure I turn the turret to the area with no objective lens. I'm going to turn this all the way down. I'm going to flip the switch off, and then I'm going to unplug my machine, and then I'm going to take our microscope cover. I'm going to put this over just so it's protected, and hopefully it'll minimize any bumps or scrapes to our microscope that helps us identify so many things and we love so much. I'm going to show you how to run a canine heartworm test, which is an ELISA test, using canine blood serum. I've set my test up. This is the blood sample. We've already spun it down in our centrifuge, and you can see we have some sample here. And I already have my snap test all ready to go along with my timer. For this test in particular, I'm going to take 3 drops of my canine blood serum. 1, 2, 3 drops. And I'm going to take 4 drops of the blue conjugate that was provided. And I remember the number of drops because blood is red, which has 3 letters, and the conjugate is blue, which has 4 letters. So 1, 2, 3, 4 drops of conjugate. Set that aside. We're going to gently invert the tube 3 to 5 times. I'm going to do all 5. And then we make sure we pour all of this into the well of our snap test. Get everything in here. And then I'm going to wait, watch that liquid seep up, and as soon as it hits the little circular window closest to me, I'm going to push it down. It's going to make a snap, which is why it's called a snap test. And this is wicking up pretty quickly, so I'll have a few more seconds and then I'm going to depress the plunger here. Alright, and I'm just starting to see the blue, so I'm going to push down. Hear the snap? I want to make sure that this area is level and push down all the way. And then for this test, we're going to set a timer for 8 minutes. Alright, so the 8-minute timer just went off for our ELISA snap test. And as you can see, only the 1 dot on top is showing, which is the control dot, and there's nothing else visible on this test. So that means that this dog is negative for canine heartworm. I will now show how to perform a fecal flotation. I'm going to go ahead and take about 2 grams of my fecal sample. place it in a cup and mix in some flotation solution. We use Ovasol, and I've pre-mixed this. And then I'm going to mix the fecal sample with the flotation solution as well as I can. I'm going to break up all of the large pieces, try to get this as homogeneous as possible for a fecal sample. And breaking up the feces allows any parasites or parasitic eggs to be mixed in with the float solution. So I'm going to try to break it up as best I can. Mix it up really thoroughly here. Then I'm going to take another cup, and with some pieces of gauze, I'm going to form a little strainer here. And I'm of course wearing gloves for this procedure because I don't want to touch any of this fecal material. Then I'll create a little spout with my cup, and I'll slowly pour it through my strainer, which will catch any of the larger clumps of feces or any other debris that's left. And any parasites or parasitic eggs that were in the sample will be small enough to fall through. I'll take this off, and then I'm going to grab a centrifuge tube, and I'm going to fill this test tube up all the way to the top until it forms a meniscus. And then I'm going to take a cover slip, put it on top, make sure it's sealed all the way around. And now I'm going to set this off to the side in a rack, and we're going to let that sit for 10 to 15 minutes. Hopefully any parasite eggs will float up to the top of the cover slip, and then once the 10 to 15 minutes has passed, I'll take that off and view it under a microscope. Alright, so now my fecal flotation solution has been sitting for about 15 minutes. So I'm going to take a clean slide, I'm going to take the cover slip off the top here, lay one edge on the slide, and then gently let it fall. And then I'm going to take this over to our microscope for examination. I'm putting my fecal flotation sample with the cover slip on microscope stage. I'm going to turn it over to 10 times magnification, and we're just going to start down at the bottom corner and scan for eggs. So I'm adjusting the fine focus. It's going to scan in kind of a zipper zigzag pattern. And I'm adjusting the fine-tune focus as I move because things can float up slightly to the top of the cover slip or down to the bottom of the slide. The main things I'm looking for, if I were to see any movement with fast-moving, parasites, anything with flagella. So looking for any ovoid-shaped eggs. And there'll probably be some of the smaller ones if I find any, because this was the fecal flotation. If I wanted to see if there were any larger eggs, I would be viewing something with the sedimentation technique, because then the heavier eggs would fall down to the bottom of the sediment. I'm seeing some debris, nothing that's ovoid shaped, little air droplets, but those are more spherical. If I were to see a parasite egg, it would be more oval shaped. It would be symmetrical, possibly have operculation at both ends, and I would probably see some granular debris inside or the forms of some kind of parasitic larvae within the egg. I am seeing a shape that's somewhat ovoid, more kidney bean shaped, and it's darker at both ends. That looks like a pollen granule. I've only seen one of those so far. I'm not even seeing a lot of those. Another pollen granule. Oh, I see a branching yeast here. It looks kind of like a little peanut shell, and there's another little piece branching off. I don't see any signs of Giardia. I don't see any signs of ovoparasites. So I would say that this fecal flotation is also no sufficient findings, so I would write NSF on that form. Now I'm going to demonstrate how to do a fecal flotation with centrifugation. I'm going to go ahead and take about 2 grams of sample, put it in a cup, and I'm going to mix it with some flotation solution. We use Ovasol. So I'm going to put some in this cup. I'm just going to really mix this fecal specimen in with the flotation solution until most of the larger pieces are broken up. And then I used a cup and just some gauze, which is going to be my strainer. Strain this solution through the gauze. I have a centrifuge tube. I'm going to carefully pour my fecal solution into the tube. Since we have a fecal centrifuge here, I'm going to go ahead and fill it up to the top until a meniscus forms. And I'm wearing gloves just in case anything drips over the edge. I'm going to take a cover slip, and now I'm placing my sample in the centrifuge, and you can see I already have a tube full of water with its own cover slip filled up to the same level, so my centrifuge is nice and balanced. Now I'm going to head close the lid, lock it. Our machine, this is only used for fecal testing. So manufacturer's recommendation is to centrifuge it for 6 minutes. Since ours, the manufacturer recommends 6 minutes, I'm going to go ahead and let that run. And then after that's run, we'll go ahead and take it out. So I'm going to head and hit the stop open button. Then it will allow me to unlock my centrifuge. I'm going to pull the sample out. And now I'm going to go ahead and put this on a rack and allow it to sit for 10 to 15 more minutes. Let any other eggs that haven't yet floated up to the top come up and hopefully reach the top of this cover slip, and then we'll come back and take it off and read it under the microscope. Now my fecal flotation with centrifugation has also been sitting here for about 15 minutes. So I'm going to do the same thing that I did for the fecal flotation. I'm going to go ahead and take a clean slide. I'm going to gently remove this cover slip from the top of my centrifuge tube. I'm going to lay one end of the cover slip on the slide and then let it fall on its own so that it presses out any of the air from that slide. Now I'm going to take this over to our microscope to read it. Alright, so now we're back at the microscope. I have my slide for the fecal flotation that's also been through the centrifuge. Then I'm going to turn to the 10 times magnification lens. I'm going to find the corner, and then I can adjust my light slightly. I'm going to turn it up just a little bit, but I don't want it to be too bright. I want to make sure I can see any of the slightly translucent eggs that might be floating here. I see a single branching yeast. It looks paperclip almost, but more rounded at the end. It's a little larger, and it has another piece of yeast budding off the side. There's something slightly cylindrical shaped. It's a little larger, and it's kind of dark, so I'm going to flip down to the 40 times magnification. It looks spherical from this angle, but it looks like it's darker at both ends. Not quite like an operculum. It takes up about 80% of the entire thing. This looks a lot like a pollen granule. It doesn't look like an egg. And if it were an egg, it would be a rather large one for something that was centrifuged. Normally for a fecal flotation, especially one with centrifugation, I'm pushing up any of the small, lighter eggs. I might note that I've seen a few pollen granules on here, but per like 10 to 15 high-powered fields, so I might not even note that these were seen on here. There's not very many of them, and that's the edge of my cover slip, so I would say that no sufficient findings, no ova or parasites seen on this slide either. Now I'm going to perform a direct fecal smear. I'm going to use the end of a cotton tip applicator because I find it allows me to grab just a tiny amount of my fecal sample and place just a small amount of this on this slide. I'm going to use just some sodium chloride saline, just a single drop of saline on my slide, and then I'm going to still use the tip of my cotton tip applicator to mix this up on the slide and create the most homogeneous mixture I can. Just get rid of any extra granules that I can. And this tiny portion right here looks like it's pretty well mixed, so I'm going to put a cover slip there. So now we have our direct smear. So now I'm going to evaluate my direct fecal smear under the microscope. And then I'm going to turn it up to the 10 times objective lens. I'm going to go to an area of my slide that doesn't have too much debris. And I'm primarily looking for any movement on the slide, any motile bacteria or parasites, anything like that that I can see. And I'm also looking for ova or parasite eggs. I'm not seeing any signs of movement. I'm seeing a little bit of debris. We can also check for particular bacteria. There's naturally going to be some bacteria that we see. We can take a look, and sometimes we'll see some Clostridium. Not that often. I'm not seeing any Clostridium here. And this was just a routine fecal sample on a dog, Giardia in the past, but that was over a year ago. This is just her annual recheck. I'm not seeing any signs of any Giardia cysts or any ova. There's a small ovoid shape. I can't quite tell what it is, so I'm going to take it to the 40 times magnification. And that doesn't look like any type of an egg. It's actually not as ovoid as I thought under closer magnification. There's slight movement on the slide, but it looks like just Brownian movement from the movement of the fluid on the cover slip. Nothing unhealthy or out of the ordinary that I see in this fecal sample. Now I'm going to demonstrate how to perform fecal sedimentation technique. We're going to take about 2 grams of our fecal sample, and we're going to mix it with a fecal flotation solution. We use Ovasol. Now using a tongue depressor, I'm going to go ahead and mix my sample in the flotation solution. Try to make the mixture a little more homogeneous so that I'm getting any parasites or parasite eggs hiding in the feces out and into the flotation solution. I fold my cup to make a little spout. I have another cup here with some woven gauze that I'm going to use as a filter. I'm going to slowly drip my solution through a centrifuge tube. And I'm going to pour my fecal mixture in until it forms a meniscus. And then I'm going to take a cover slip. I'm going to put it on the top and make sure it's sealed. And then I'm going to come over, place it in the centrifuge, making sure that it's balanced with another tube of the same size filled with the same amount of water, also with a cover slip to keep the liquid inside. I'm going to go ahead and let this run. So my centrifuge tube for the fecal sedimentation has been going for the full 6 minutes, so I'm going to go ahead and take it out here. I'm going to remove my sample. And for this one, I'm not worried about any of the flotation solution or the liquid. I'm going to carefully pour off the fluid, leaving the sediment down at the bottom here. I'm going to take a clean microscope slide. I'm going to use this loop to take a small amount of sediment sample. I'm going to place that on my slide, kind of move it around until it's pretty thin. Take a cover slip, then we're going to take this over to the microscope. So now I have my fecal sedimentation slide. I'm going to turn to the 10 times magnification, find a good spot where I see some material on here, and then I'll turn my light on. Eggs that might be on this slide, and they can be rather translucent or see-through. And I'm going to look around as much of the slide as I can through this sediment and see if I see anything. There's a lot of debris. This technique primarily is meant to find any larger ova or eggs. It's usually used in larger animals. This is a sample from a dog, so I might not really see anything, but there are certain parasite species that have heavier eggs that won't float to the top with just fecal flotation solution. I'm not seeing anything shaped like a parasite egg. One more thing I want to look at. Nope, a tricky little piece of debris, but not a parasite egg. I'm getting to the edge of my slide here. All right, well, I've reached the edge of my smear here and I don't see anything of note. So I would say that this is so NSF for any ova or parasite seen in this sedimentation. Now I'm going to demonstrate how to do a blood serologic test. It covers ALT, ALP, creatinine, glucose, total protein, and urea nitrogen. I have my blood serum. This has already been spun down in the centrifuge, so I have some serum here. I'm going to go ahead and take a micropipette. I'm going to draw some of the serum up into the pipette, and then I'm going to find the little window that we have on this abaxis test. I'm going to push it in until it reaches the edge of that window. And then we're going to put it in our screen. So this is our blood chemistry runner. We have the VetScan VS2, so I'm going to hit Analyze. It's going to open the drawer. I'll put my disc in with my serum sample that's inside. I'm going to hit Close. And it's going to ask for the patient's information. So this is on Chai, who's a cat. He's 14 years old, and this is a patient ID number that's a hospital use. It's going to analyze that for a few minutes, and it's going to log them on this screen. Use Infinity, so it's going to log that automatically for me, and then I can print it. So once it's done running, I'll show the printout with the results. It looks like our chemistry machine is done spinning, and it went ahead and it automatically imported the results here into our electronic system. So I'm going to go ahead and click on these, and you can see the results that we have on the side here. So I'm going to go ahead and hit Print. There it comes. All right, and there you go. Blood serum results printed out. It's already saved in our electronic system, and now I have a physical copy that I can also give to the doctor to show. All right, so now I'm going to show how to collect a ear swab on my friend Junebug here. So for ear swabs, I'm going to use a cotton tip applicator, and I know, Junie, you're going to be wiggly because you're a pug. So I grab her pinna, make sure I can visualize the ear canal, and then I'm going to put the Q-tip in while being careful not to push any of the wax too far down into her ear. I'm going to make sure I'm in the vertical canal and just gently roll until I get some sample. And then I'm going to hold the slide sideways and gently roll it onto here. I want to make sure I'm not putting too much pressure and I'm not just rubbing back and forth because that can cause destruction of cells that I'm going to want to view later. And then I'm going to use a separate Q-tip for the other ear. You're going to do the same thing in this ear. Gently inserting the cotton tip applicator, rotating it. Good job, Junie! So now I have a little bit of sample on here. I'm going to again gently roll it this time onto the other. So we know while holding this in the left hand, the sample on the left is the left ear, the sample on the right is the right ear. So now I'll take this into the lab to stain it. Now we're going to stain our ear swab cytology. So I'm using a Diff Quick style stain that's a Romanowski type stain set, and it's for dirty samples such as fecals, ears, and skin. We want to keep them separate from anything we want to keep sterile like a urinalysis so that there's no cross-contamination with bacteria or anything like that. So I'm putting it in the first stain, which is a light blue fixative and also a stain itself. I'm going to leave that in for about 2 to 5 minutes and then I'll come back to move it to another stain. So now that my ear cytology has been in this first stain for about 5 minutes, I'm going to go ahead and just kind of knock some of this extra fluid off from the first stain and then transfer it into our second stain. And I make sure to close the first stain behind me when I'm done because that one can evaporate rather quickly and I want to keep that from happening. I'm going to let it sit in this second stain for another 5 minutes and then we'll come back and transfer it to the final stain. Now my ear cytology has been in this stain for about 5 minutes. I'm just going to shake off the extra stain here, just place it right in the third stain, and let that sit another 5 minutes. So my second stain here is a pink tinted right Giemsa type stain. This third stain here is also a right Giemsa type stain, similar to a methylene blue stain. It has a dark violet color, and that's going to pick up any gram-positive bacteria as well as a lot of other things in the microscope to give us a little extra detail when we go to view it. So I'm going to let it sit for another few minutes and then we'll come back, rinse it off, and let it air dry. Alright, so now that our ear cytology has been in this third stain for a little bit, I'm going to shake off what I can back into the stain. Then I'm going to come over to the sink and take some of my clean water here, just gently rinse the slide off front and back and just get as much of this off as I can until the water dripping off no longer has a blue or violet tint to it. And then I have a little paper towel over here. I'm just going to prop it up against this, let it sit here. We're going to let it air dry. That'll take a few minutes and then we'll go ahead and evaluate it with the microscope. So now that Miss Junebug's ear swab cytology has been stained and dried, put it on the stage, 10 times magnification, the sample taken from the left ear. And I'm just gonna look through here, kind of try to scan most of this slide. Some debris. Little Junebug has a history of food allergies. The owner was afraid that she might be showing early signs of another allergy flare-up. So I would expect if there was an infection to come back again. Generally dogs that have food allergies tend to manifest it with yeast infection. So I would primarily be looking for yeast. I'm not seeing much on here. A single yeast here. It looks like the shape of a peanut with, the peanuts in the shell. A little more rounded on one side, almost like a bowling pin, even. So I'm going to go over to the right ear, which is on the other end of my slide. I made sure to leave a good space with no material on the center so I know the differentiation between the left ear swab and the right ear swab. Alright, so I've looked at both the left ear swab and the right ear swab. I haven't seen any signs of yeast. So I flipped down to the 40 times magnification, and here at the smaller objective lens, I'm looking for any signs of any bacteria. They're going to be either rods or coxy, and the rods are going to be rod-shaped, just a long line that are rounded at the end. They're going to appear dark violet because they took up that stain. I don't see any signs of those. They could be on their own. They could be, in a line or in a cluster or branching. The coxy would be sphere-shaped, tiny little circles. They could also be clumped together or in a line, and they would also be a dark violet color. Again, I'm looking for rods or coxy or any other form of bacteria in this ear as well. Both the left and the right ears, I would say there are no sufficient findings, and I'm not a doctor, so I can't diagnose anything, but I think Junebug's owner would be happy to know that there are no signs of a yeast infection seen on this sample today.
We're going to open the body cavity and get everything exposed so we can take our samples and you can see how much fluid is in this abdomen. Exorbitant amount of fluid buried, so this is an FIP case. So there you go.
Hey. I was just asking how often they get FIP cases.
Well, there you go. Now we know what he was in the hospital being treated for. So classic, this gelatinous fluid, with FIP, you get a lot of proteinaceous fluid that's coming out of the body, and it kind of gels up like this. And the other classic lesion is all this white speckling stuff everywhere. Those are the granulomas of FIP. So
That's all over the
it's everywhere. Right? We take our fresh frozen samples.
And these have all been pre-labeled beforehand, so we don't have to worry about labeling them afterwards, and we have identification of all the proper ones.
At this point, when we open the body up, we take big samples because we have to go back and culture something. They will cut it and they'll burn the insides of it to sterilize the surface, and then they'll go in and culture it. Nothing is sterile about it.
So here you had a bit of the spleen and a bit of the liver, and
right.
This is kidney.
That's kidney.
Right. So here are fresh frozen samples to be saved for later.
Right. So I'm going to take a sample of this, put it in formalin so I can look at it under the scope, and that will also help to confirm the diagnosis, and if we have to do some testing like immunohistochemistry, I can do it on that fixed tissue. We're just going to go through and take our samples. Again, everything can go in formalin.
And when she hands me samples, I'm being careful with the container because we know that formalin is a carcinogenic substance.
Right. So we're looking at the heart and the lungs. You can see that the lungs they're dark red, but they're normal. Make sure we're not finding anything. We're not taking representative lung samples. Alright. We're going to take a peek at the heart. I'm going to take some different areas of the GI tract. So there's our brain. Right?
All right, and now that we've finished our necropsy, just a few things of note. If we had any reason to believe that that patient had died from rabies, we hopefully would have gotten some indication from the owner that the pet was having mood swings, showing more aggressive behavior, any kind of ataxia, neurological signs, or foaming at the mouth. Maybe if it had come into contact with another cat and had any chance of exchanging saliva or blood or bodily fluids, we would have taken every precaution to make sure that the only people working with that animal were technicians that had been pre-immunized against rabies, and they would have had titer tests to make sure that their immune systems were protected, and extra protective equipment. So we already had the face mask on and the gloves and the arm sleeves. If there were any chance that it were a rabies infected patient, there would also be special eye personal protective equipment that we would have used, and also an extra apron, double gloves, and we would have been very, very careful of any bodily fluids that we would come in contact with, as that would be the main way that rabies would transfer zoonotically from the patient. Also, if we wanted to test for rabies, the animal would have been completely decapitated and sent in so that the brain could be evaluated for rabies using fluoroscopy techniques. And if we were needed to send any of those samples out for Mr. Ben, we would make sure that the head was double bagged and shipped in a container cold on ice. The body would also be double bagged and disposed with a biohazard bag and a label saying that it was a possible rabies suspect, so that everybody knows to dispose of that in a way that you would see if it was a rabies suspect. Okay, so now we're going to do a vaginal cytology on a canine patient. This is Liliana. She's getting spayed today. So I'm going to go ahead and show you how we wash the vulva first, and then Dr. Kimmel here is going to obtain the vaginal swab. So I'm just going to scrub the vulvular area. Right, so now that we've washed the area, Dr. Kimmel has a cotton tip applicator here that we've moistened with sterile saline solution that's 0.9% NaCl. She's advancing the Q-tip almost vertically and then down into the vagina, and she twisted it gently and pulled out. And now I'm going to take this Q-tip and I'm going to take a slide and gently roll the sample onto the slide. And we made sure to wet this Q-tip with saline so that while it was introduced into the vagina, it wasn't causing any extra cell damage while it was pressed along. Now I'm going to take this in the lab. From our vaginal cytology for Miss Liliana, so now I'm going to stain it. We have separate stains for clean stains, as we call them, such as urinalysis, where we don't want bacteria to get in the way of our reading or contaminate our sample. So first, I'm going to put it in this first stain, which is kind of a fixative. So I'm going to let it sit in the first stain for 2 to 5 minutes. Alright, so now the slide's been in the first stain for 5 minutes. So I'm going to go ahead and then I'm going to put it in my second stain. And our second stain is kind of a pink tinted stain. It's a right GM stain. Let this sit in here for another 5 minutes and then we'll transfer it to the final stain. It's been sitting in the second stain for 5 minutes now. I have to get any excess liquid off and then place it in my third stain. The third stain is darker. It appears dark violet to me. And it's also a right GMSA type stain that's a lot like the methylene blue type stain. We're going to let that sit for 5 minutes in this stain as well, and then we'll pull it out and rinse it off before we view it. So now that my vaginal cytology has been stained and sitting out to dry for quite some time, it looks visibly dry to me. It to the 10 times magnification, and I'm going to find a good area for cells, and then I'm going to go down times power magnification to get a closer look at these cells here. The owner had described that her, vulva wasn't swollen, she wasn't having any red or even pinkish tinge discharge, she had no vulvar discharge. I'm seeing some parabasal cells, a few neutrophils. I don't see very many erythrocytes. So the parabasal cells have a slightly blue tinged cytoplasm with a moderately sized nucleus, but I wouldn't say that they're large enough to be intermediate cells, and definitely not any superficial cells. They're not exhibiting any cornification. Their nuclei don't look pycnotic to me at all. They look like normal nuclei, well-rounded, not too granular. A lot of neutrophils. It seems as if this dog is in anestrus. It's difficult to determine if a dog is in anestrus or metastrus. My guess would be that she's in anestrus at the moment, simply because after metastrus, the number of white blood cells seen increase for 3 days and then quickly decrease until almost no white blood cells are seen. And I know that this dog definitely wasn't in estrus because I would be seeing primarily intermediate or superficial cells, and they would all be cornified, and they would have either a pycnotic nucleus or no nuclei at all. Maybe even some basal cells, parabasal cells, and have very distinct nuclei. And I'm not seeing too many erythrocytes. There's a few bacteria present here. And in proestrus, I would be seeing a lot of red blood cells, and I don't see too many red blood cells in here, so I'm going to go ahead and say that this dog is in anestrus. So now I'm going to do a skin scraping of Mr. Bo. He tested positive for Demodex a while ago, so this is his recheck skin scrape. And I have a dull scalpel blade that I already put some mineral oil on, And I have some slides over here off to the side that each have some mineral oil as well. I'm going to take his skin, pinch it really well. We're trying to kind of push the capillaries up a little bit because that's where the mites are going to be hiding in the hair follicles. And I'm just going to take this scalpel blade, just run it along back and forth on this area until it starts to bleed a little bit. Okay, so I'm starting to see a little bit of blood beading up here. So that means I've kind of scraped the hair follicles, and now I'm going to scrape this along the edge of the slide, try to get all of that material off. And I'm going to try to disperse this a little more evenly in the oil. And then we'll look at that under the microscope. So now that we've obtained our skin scraping, I'm going to go ahead and evaluate it under the microscope. 10 magnification objective lens. For things like mites, I'm going to keep the light a little bit on the lower side. This skin scraping was obtained on a canine who had previously tested positive for Demodex, of broken shafts of hair, a lot of debris, but just because we don't see anything doesn't mean that they don't have any more. For scraping, I was trying to pinch up on the skin to push up on the capillary beds, and also to kind of push up because Demodex hide down at the hair follicle itself. And that's why we scrape until we see blood welling up from the capillaries, because that's how we know we've gotten deep enough. Here's one. So I just found one mite. It doesn't appear to be moving, so it looks like this mite is dead. Demodex mites are shaped kind of like an odd upside down cone, and then they have the legs up at the top. The live ones will kind of be wiggling around a little bit. And I just found another one. This one's alive. I can see the legs up near the head moving around. All right, and I found another dead mite. He's not moving either. So now I've scanned the entire slide. I found 2 dead mites and 1 live one. So this was drastically improved from the last time we saw Demodex in this dog, but it does mean that there are still some that are visible. At this point, I would make sure I record my results, and then I can toss this slide. I'm going to demonstrate how to do a major and a minor cross-match on both a donor and recipient patient for blood transfusion. Blood over here. So in the red top tubes, this is the serum. This was drawn from the donor animal, and I centrifuged it down, and then I just poured the serum. That's his serum. And then we also had some of the blood. This is in an EDTA tube, which is an anticoagulant, so we went ahead and spun that down, and I've already decanted off the plasma, so you can see all of the packed erythrocytes in this tube. All of the same things for my recipient animal. So this is for Miss Roxy, who's a little beagle. I also spun down her serum and separated it into this tube, spun down her EDTA tube, and decanted the plasma off so you can see the packed red blood cells. Now I'm going to go ahead and wash the red blood cells. So I have a clean glass tube. I've already labeled it for Linus, my donor, and Roxy, my recipient. So I'm going to take some of this blood in here, and I'm going to put 1 to 2 drops of this. I'll do 2 drops for now. 2 drops of the packed erythrocytes from our donor into the tube. I'm going to fill the rest of it up with 0.9% sodium chloride solution, which is saline. I'm going to do the same thing for I'm going to put 2 drops in this tube, and then I'm going to go ahead and take some saline. I'm going to fill up this tube as well. So now the erythrocytes have been washed for 1 minute, so I'm going to pull them out of the centrifuge. And you can see down at the bottom that's been nice and separated. The red blood cells have been pushed down to the bottom. So I'm going to go ahead and decant all of this off, remix it, 1 to 2 drops of these red blood cells with saline, and wash them for another minute. Alright, so I decanted off the supernatant again, and now I'm going to refill these tubes with some of this sodium chloride solution. We're going to rebalance and recentrifuge for another minute. Make sure my door is closed. Make sure I'm set at the right rotations per minute and time, and then start. We'll come back and do that one more time. Okay, and then a final time I'm going to decant off the supernatant and then mix a little more saline and rotate it one more time. Okay, so I decanted that supernatant off. I'm going to add some saline and recentrifuge one more time. Okay, so the tops are on nice and tight. Centrifuge is balanced again. Still at the same RPM and time. Okay, so I just took them out of the centrifuge after the final wash, and you can see that the supernatant is nice and clear, which means the erythrocytes have been thoroughly washed. So I'm just going to decant off the supernatant one more time. Now I've decanted both of these off. So I'm going to take some of the packed red blood cells, and I have 0.98 milliliters of saline pre-prepared in here. I'm going to carefully take out 20 microliters, put it in my suspension. So this is a 0.02 mils of red blood cells to 0.98 mils of sodium chloride suspension. I'm going to do the same with my donor blood, and I'm going to do the same with my recipient blood. Alright, so now I have both the serum and the washed erythrocytes for both the donor and the recipient animal. So I'm going to begin my major cross-match by putting 2 drops of the recipient serum and 2 drops of the donor's erythrocyte wash in here. So I'm going to take the recipient's serum sample, and I'm going to carefully put 2 drops into this vial, and then I'm going to take 2 drops of the donor, so the donor's erythrocyte wash. Alright, so that is mixed for our major cross match, which I have labeled here. And then for the minor cross match, it's just going to be reversed. So we're going to do the donor's serum sample and the recipient's washed erythrocytes. The donor's serum, 2 drops again of each mixture, 2 drops, and the recipient's erythrocyte sample, 2 drops. So now I have both my major and my minor cross matches. I've labeled both of them. I'm also going to create some control samples. This is the donor's serum sample. I'm going to put 2 drops of the donor's serum, 1, 2, in with 2 drops of its own erythrocyte. And this way, I know that if I look and see agglutination with this sample later, then something went wrong with my test. I shouldn't be seeing agglutination for a donor's red cells receiving its own serum. So I'm also going to do the same thing for the recipient. I'm going to take 2 drops of the recipient's serum, and then 2 drops of its mixed red blood cells. So now I have all my major and minor cross matches and both my control donor and recipient matches set off to the side. Now I'm going to shake all of these gently to mix them up. Make sure I get all of the serum and the erythrocytes mixed up nicely. They're going to incubate for 30 minutes, and then I'll look at them under the microscope and see how the cells are reacting to the serum. All of my samples, I have the major and the minor cross-match along with both of the control samples. They sat at room temperature and incubated for half an hour, and then I spun them in the centrifuge one more time at 3,400 RPM for 1 minute. So now I'm going to check my major and minor cross-match for obvious agglutination. I just kind of gently shake them up here, and I'll bring them closer. You can see they look pretty uniform. I don't see any obvious agglutination under macroscopic examination. So now I'm going to examine them microscopically. So first I'll take my major cross-match. Just going to take a single drop and put it on a slide. And I'm going to apply a cover slip to 10 times magnification. And I see lots of erythrocytes. They tend to be pretty well spread out. And I don't see any major packets of agglutination. There's not even anything that could be confused with rouleau. So if I were seeing rouleau, there would be some red blood cells in a line, and they would look like a roll of coins. And agglutination is going to look more like a clump or a cluster, almost a grape-shaped cluster. And all that I'm seeing here are evenly spaced erythrocytes. None of them are clumping together from what I can see. Now I'll do the same thing with my minor cross-match. Take a single drop of my mixture on the slide. Take a cover slip. Very similar. I'm seeing lots of tiny little erythrocytes and red blood cells. None of them seem to be stuck together. So I'm going to conclude that there is no autoagglutination. So it looks like Mr. Linus would be a good donor for Mrs. Roxy.